Before we start, a reminder that Lucy Letby faces 22 charges, 7 of murder and 15 of attempted murder. She has entered not guilty pleas to all charges. Child N attempted murder, 3 allegations. Child N, a boy, was born in June 2016. He was a couple of weeks premature and he was admitted to the neonatal unit. His clinical condition was excellent. The prosecution say there are 3 separate occasions on which Lucy Letby tried to kill him. Child N had haemophilia. Subsequent investigation found him to have a mild version of the disease, and children of his age do not bleed for no reason, particularly in the throat, the prosecution say. The prosecution said Lucy Letby used Child N's haemophilia as a, quote, cover to attack him. On the night of June 2nd, Letby was on the shift and not the designated nurse for Child N. She had earlier texted friends and sent a message to a colleague saying, quote, "We've got a baby with haemophilia." She sent a further text saying, quote, "Everyone bit panicked by seams of things, although baby appears fine." At 8:04 p.m, she sent a text saying that she was going to, quote, "Google haemophilia." 7 minutes later, Letby texted her colleague, quote, "Complex condition, yeah, 50-50 chance antenatally," end quote. The designated nurse said Child N was stable and left for a break at about 1 a.m. He would have asked a colleague to look after Child N, but he could not recall which one. Letby had 2 babies to care for in room 4. At 1:05 a.m, Child N's oxygen sat levels fell from 99% to 40%. Unusually for a baby, he was described as crying and screaming. Child N recovered quickly while the doctor was then called to another emergency. Medical expert Dr. Evans said he believed the deterioration of Child N was, quote, consistent with some kind of inflicted injury which caused severe pain, end quote. Dr. Sandy Bowen said such a profound desaturation, followed by a rapid recovery in the absence of any painful or uncomfortable procedure, suggested an inflicted painful stimulus. She said, quote, "This is life-threatening. He was also noted to be screaming and apparently cried for 30 minutes. This is most unusual. I have never observed a premature neonate to scream." 12 days later, there were 2 separate incidents on June 15th for Child N. Letby had been the designated nurse for the previous day. Overnight, he was in nursery 3. At the beginning of the night shift, Child N was, quote, very unsettled. Letby was to be the designated nurse for June 15th. The use of her phone appeared to show she was awake by 5:10 a.m. and in for her shift at 7:12. She had texted a colleague that she had, quote, escaped room 1 and was back in room 3. A colleague said Lucy Letby came into the room to say hello, but when the nurse's back was turned, Letby told her Child N had desaturated before assisting with the breathing. There was no evidence of an alarm sounding or if Letby waited to see if he self-corrected. Doctors were called and an attempt was made to intubate Child N. He was, quote, surprised by his anatomy more than anything else. I could not visualise parts of the back of his throat because of the swelling. The doctor saw fresh blood in Child N's throat, which the prosecution say was the same seen in Child C, E and G. The doctor was unable to get the breathing tube down the throat of Child N as he was unable to visualise the child's tracheal inlet. He attempted to intubate Child N on 3 occasions. An intensive care chart is presented to the court, which records the amount of dextrose going into Child N. The bleeding record of 10 a.m, 1 ml fresh blood recording aspirates from the NG tube. Said bleeding, the prosecution say, is not recorded anywhere in the medical notes. It was more than 2 hours after the attempts to intubate. At 11:29 a.m, Letby sent a Facebook message to the doctor telling him, quote, small amounts of blood from mouth and 1 ml from NG. Looks like pulmonary bleed on x-ray, i.e. a bleed from the lungs, given factor 8, wait and see, end quote. Other than that phone message, there is no evidence that Lucy Letby brought the bleeding to the attention of any of the medical staff. The prosecution said this is surprising, given the problems Child N had suffered. In an update recorded on the computer notes by Lucy Letby at 1:53 p.m, she wrote that Child N was, quote, stiff on handling and extending upper limbs, back arching, settled in between episodes. The prosecution say this is similar to that found in other cases heard so far. At 3 p.m, there is a further entry in Letby's writing of 3 ml blood, initialled not by Letby and coincides with a second collapse that day. Child N collapsed just before 3 p.m, and a consultant was called at 2:59 p.m. While awaiting a consultant, a junior doctor looked into the airway of Child N and saw a, quote, large swelling at the end of his epiglottis. He could only just see the bottom of the vocal cords. He had never seen anything like this in a newborn baby. The junior doctor's notes, made at 4:30 p.m, recorded, quote, desaturated this afternoon at 2:50 p.m, with blood in the oropharynx and blood in the NG tube. Improved with bagging. Elective intubation planned following unsuccessful attempts with 2 registrars and 2 consultants, cords difficult to visualise. Letby recorded at 6:30 p.m, quote, approximately 14:50 infant became apneic with desaturation to 44%, heart rate 90 beats per minute, fresh blood noted from mouth and 3 ml of blood aspirated from NG tube. DRS crash called. The prosecution said Child N was so unwell that attempts were made to re-intubate him, but the doctor could not see down Child N's throat as the view was obstructed by fresh blood. A more specialist team was called to carry out the intubation. Child N continued to be unwell on June the 15th, and difficulties with ventilation persisted. Eventually he was transferred to Alderhay, where the prosecution say he recovered quickly. Medical expert Dr. Evans said the blood seen in Child N's stomach had originated there, caused not from intubation attempts, but, quote, instead some preceding trauma. He suggested that thrusting an NG tube into the back of the throat might be the mechanism used to inflict the injury. Dr. Sandy Bowen suggested only 2 possible explanations, either inflicted trauma or a spontaneous bleed. She considers the latter less likely, as the haemophilia was, quote, only moderate. Dr. Bowen's view was that the likely cause of the bleeding was trauma to the mouth, to the throat or to the oropharynx, most likely from an NGT or suction catheter. Professor Sally Kinsey describes the collapse on June the 3rd as dramatic with no recognised medical cause. She excluded the possibility of a pulmonary hemorrhage, in other words, bleeding in the lungs, causing the collapse on June the 15th. In her opinion, such bleeding would not have occurred spontaneously in a child with Child N's degree of haemophilia. It follows, the prosecution say, the bleeding was caused by trauma. Professor Kinsey also ruled out heavy-handed intubation as a cause. In police interview, Letby had difficulty remembering Child N. She did recall an occasion when doctors had difficulty intubating him. She agreed that she had seen blood, but denied being responsible for causing him harm. She could not explain the entry in her notes timed at 10 a.m. on June the 15th, in which she recorded aspirating more fresh blood, which she had not apparently brought to the attention of anyone else. Child O, murder allegation. Child O and Child P were 2 of 3 triplet brothers, the court hears. Child O weighed 2.02 kilograms, which was good for a premature triplet. He was in good condition and made good progress. He was stable up till June the 23rd, when he suffered what Dr. Evans said was a, quote, remarkable deterioration and died. Between June the 15th and June the 23rd, Lucy Letby had been on holiday in Ibiza. Child O's body was examined after his death, and an injury to his liver was found. Letby was working the day shift on June the 23rd and was the designated nurse for Child O and P in room 2 with another child. The prosecution say this, quote, gave her an opportunity to sabotage the babies. The third of the triplets was in room 1, the doctors believing he was the most needy of the triplets. Letby also had the responsibility of supervising a student nurse that day. The designated nurse recorded, quote, no nursing concern, observations normal for Child O. There are 3 records of feeds by Letby at 8:30 a.m, 10:30 a.m, and 12:30 p.m. The earliest signed by the student nurse, the latter 2 signed by Letby. In a note made by the doctor at 1:15 p.m, there was, quote, 1 vomit post-feed with abdomen distended. Child O was put onto IV fluids as a precaution. Child O's heart rate was 160 to 170, blood gases were low and raised CO2 level. The doctor recorded the results as, quote, not normal for a child breathing on their own, and treated for suspected NEC. It was thought down to child O's swallowing of air or the passing of a stool earlier. An X-ray taken at the time showed a moderate amount of gas in the bowel loops throughout the abdomen. Letby noted at 8:35 p.m, quote, reviewed by registrar at 1:15 p.m. Child O had vomited undigested milk, tachycardic and abdomen distended. NG tube placed on free drainage. 10 ml saline bolus given as prescribed along with antibiotics. Placed nil by mouth and abdominal X-ray performed. Observations returned to normal. Prior to child O's collapse, a colleague said of child O, quote, he doesn't look as well now as he did earlier. Do you think we should move him back to room 1 to be safe? Letby did not agree. The prosecution say this echoes the final fatal collapse of child I. Letby had taken child O's observations at 2:30 p.m. as 100% oxygen saturations and normal breathing rates. From her phone, she was on Facebook Messenger at the time, and at 2:39 p.m, the door entry system recorded her coming into the neonatal unit. Within a few minutes of that, child O suffered his first collapse. Letby called for help, having been alone with child O in room 2 at the time. Child O's heart rate and saturations had dropped to dangerously low levels. A breathing tube was inserted by the medical staff and he was successfully resuscitated. He was kept on a ventilator. At 3:49 p.m, child O desaturated again. Doctors removed the ET and replaced it as a precaution. Letby's written note suggests she was the one who called for help. Child O suffered a further collapse at 4:15 p.m, which required CPR. Those efforts were unsuccessful, and child O died soon after treatment was withdrawn at 5:47 p.m. A consultant doctor noted child O had an area of discoloured skin on the right side of his chest wall which was purpuric. He noted a rash at 4:30 p.m. which had gone by 5:15 and did not consider it purpura, but unsure what it was or what had caused it. The doctor was particularly concerned about child O's death as he was clinically stable before these events. His collapse was so sudden and he did not respond to resuscitation as he should have. After the shift, Letby sent a series of messages to the doctor on Facebook and to her colleague. She suggested child O, quote, had a big tummy overnight, but just ballooned after lunch and went from there. A post-mortem examination found free unclotted blood in the peritoneal abdominal space from a liver injury. There was damage in multiple locations on and in the liver. The blood was found in the peritoneal cavity. He certified death on the basis of natural causes and intra-abdominal bleeding. He observed that the cause of this bleeding could have been asphyxia, trauma or vigorous resuscitation. The prosecution say no one would have thought a nurse would have assaulted a child in a neonatal unit. Dr. Evans concluded child O's death was the result of a combination of intravenous air embolus and trauma. The liver injury was not in his view consistent with vigorous CPR. His view was that the liver damage would have occurred before the collapse and contributed to it, and was probably the reason for his symptoms through the morning. As for the air in the bowel loops, Dr. Evans concluded that that was consistent with excessive air going down via the NGT. Dr. Bowen concluded that together with the chest wall discoloration seen by the doctor, that was indicative of air having been injected into child O's circulation. She agreed that the abdominal distension was due to excess gas via the NGT. Dr. Andreas Menarides, the reviewing pathologist, thought that the liver injuries were most likely the result of impact-type trauma and not the result of CPR. He thought that the excess air via the NGT was likely to have led to stimulation of the vagal nerve, which has an effect on heart rate and would have compromised child O's breathing. He could not say whether it was either of these factors in isolation or in combination which caused child O's death. He certified the cause of death to be, quote, inflicted traumatic injury to the liver and profound gastric and intestinal distension following acute excessive injection or infusion of air via a nasogastric tube and air embolus. In police interview, Letby said she had responded to child O's alarm at 1:15 p.m. and found he had vomited. She responded at 2:40 p.m. and discovered mottling all over with purple blotches and red rash. She said that his abdomen just kept swelling and suggested that sometimes babies can gulp air when they are receiving assistance from Optiflow, as child O was. A year later, on the anniversary of child O's death, Letby carried out a search on Facebook on the surname of the child.